Your kidneys play a crucial role in maintaining your overall health and well-being. They are responsible for filtering waste products and excess fluids from your bloodstream, regulating your body's fluid balance, and ensuring that your blood pressure stays at healthy levels. In addition, they produce hormones that help control red blood cell production and bone health. However, as we age, the efficiency of our kidneys can decrease, and they can face increased stress due to a variety of factors such as underlying health conditions, dehydration, or poor lifestyle choices. This added strain can cause the kidneys to become less effective at performing their vital functions, and they may begin to show signs that they need attention. It's essential to be aware of these warning signs so you can take action and protect your kidney health. Here are 8 important warning signs that your kidneys might be asking for help. Frequent urination. If you notice that you're making trips to the bathroom more often than usual, particularly during the night, this could be a sign that your kidneys are having trouble filtering waste and maintaining a proper fluid balance. The kidneys are responsible for regulating your body's fluid levels, and when they're not functioning optimally, they may produce more urine than usual. This excess production of urine can disrupt your daily activities and cause unnecessary stress on your body. Nighttime urination, also known as nocturia, can be especially concerning, as it may indicate that the kidneys are working harder than they should be to filter waste. In addition to disrupting your sleep, frequent urination at night can be a sign that the kidneys are unable to concentrate urine properly, which can lead to a higher volume of urine output. This might be due to the kidney's inability to reabsorb enough water or manage sodium levels effectively. As a result, you could be waking up multiple times during the night to relieve yourself, impacting your overall quality of rest, and leaving you feeling fatigued the next day. This frequent urge to urinate, especially when it interrupts your sleep, could suggest that the kidneys are under stress and unable to perform their essential functions as effectively as they once did. If you experience this symptom consistently, it's important to seek medical advice to assess your kidney function and rule out underlying conditions that might be contributing to the problem. Swelling in your legs, ankles, or feet. When the kidneys are not functioning properly, they may struggle to filter out excess fluid and waste from the body. As a result, fluid can accumulate in different areas, especially in the lower limbs, leading to noticeable swelling in your legs, ankles, or feet. This condition, known as edema, can occur because the kidneys are unable to maintain the proper fluid balance. When the kidneys aren't working efficiently, the body can retain sodium, which in turn causes the retention of water. This imbalance can lead to fluid buildup that is difficult for the body to eliminate. Swelling may start off as mild but can become more pronounced over time. It's often more noticeable at the end of the day or after prolonged periods of standing or sitting, as gravity pulls the fluid downward, leading to a buildup in the lower parts of the body. In some cases, swelling may be accompanied by a feeling of heaviness, tightness, or discomfort in the affected areas. The skin in the swollen areas may also appear stretched and shiny. If you notice persistent swelling, especially if it's accompanied by pain, discomfort, or a sensation of tightness, it may be an indication that your kidneys need attention. Ignoring these signs could lead to more serious health issues, so it's important to consult your healthcare provider to determine the cause and receive proper treatment. The earlier kidney issues are detected, the better the chances of preventing further complications. Fatigue and weakness. Your kidneys play a vital role in regulating the production of red blood cells by releasing a hormone called erythropoietin. This hormone signals your bone marrow to produce red blood cells, which are essential for carrying oxygen throughout your body. When the kidneys are not functioning properly, they may not produce enough erythropoietin, leading to a decrease in red blood cell production. As a result, you may experience symptoms of anemia, such as fatigue, weakness, and a lack of energy. This can make even simple tasks feel more difficult and leave you feeling unusually tired, no matter how much rest you get. In addition to a reduction in red blood cells, kidney dysfunction can cause a buildup of waste products and toxins in the body, which the kidneys would normally filter out. As these toxins accumulate, they can lead to a general feeling of exhaustion and contribute to muscle weakness, making it harder for you to stay active and engaged in daily life. This feeling of constant fatigue can often be accompanied by difficulty concentrating, dizziness, or a lack of motivation, all of which can affect your quality of life. If you find yourself feeling more drained than usual, and it's not improving with rest or a balanced diet, it could be a sign that your kidneys need attention. While fatigue is a common symptom of many conditions, persistent tiredness despite lifestyle changes or adequate sleep should not be ignored. It's important to check with your healthcare provider to ensure that kidney health isn't the underlying cause, as early intervention can help prevent more serious complications and restore your energy levels. Shortness of breath. If you find it hard to catch your breath even with minimal effort, this could be a sign that your kidneys are not removing enough fluid from your body, leading to fluid buildup in the lungs. The kidneys are responsible for filtering excess fluids, and when they are not functioning properly, fluid can accumulate in various parts of the body, including the lungs. This condition is known as pulmonary edema. As fluid builds up in the lungs, it makes it difficult for oxygen to pass into the bloodstream, causing shortness of breath. This fluid buildup not only affects your ability to breathe, but can also result in a feeling of suffocation or tightness in the chest, making it harder to relax or feel at ease. You may experience difficulty breathing even during light activities, such as walking or climbing stairs, or while lying down, especially at night. Some people find themselves waking up in the middle of the night feeling short of breath, a condition called paroxysmal nocturnal dyspnea. The increased fluid in the lungs can also lead to a persistent cough, often accompanied by frothy, pinkish sputum, which is a sign of the fluid and blood mixing in the lungs. This type of breathing difficulty can be alarming and may cause anxiety or panic, especially if it comes on suddenly or worsens over time. If you notice this type of breathing difficulty, it's important to seek medical attention, as it could be an indication of kidney problems or other serious conditions, such as heart failure, that need immediate care. Pulmonary edema can be life-threatening if left untreated, and timely intervention is essential to prevent further complications. Your healthcare provider will need to perform a thorough evaluation to determine the underlying cause and provide appropriate treatment. Changes in urine color. If your urine becomes dark, foamy, or bloody, it could indicate an issue with your kidneys. Healthy urine should be light yellow and clear, which is a sign of good hydration and proper kidney function. When the urine appears darker than usual, especially if it turns reddish, brown, or even tea-colored, it may suggest the presence of blood. Blood in the urine, known as hematuria, can be an alarming sign and might indicate kidney damage, infection, or other underlying issues. If the color change is persistent or severe, it's important to seek medical attention promptly. Foamy urine, on the other hand, can be a sign of protein leakage, which occurs when the kidneys are not filtering properly. Healthy kidneys typically prevent protein from escaping into the urine, but if they are damaged, proteins like albumin can leak out, creating a foamy or bubbly appearance. This could be an early sign of kidney disease, especially if it happens consistently or worsens over time. Protein in the urine, known as proteinuria, is one of the most common indicators that the kidneys are struggling to filter waste and maintain balance in the body. In addition to dark or foamy urine, bloody urine could also be a sign of more serious conditions such as kidney stones, urinary tract infections, UTIs, or even cancer in the kidneys or bladder. Kidney stones in particular can cause sharp pain along with blood in the urine, while UTIs can lead to blood when the infection reaches the kidneys. If you notice any unusual changes in the color or consistency of your urine, especially if it's accompanied by pain, discomfort, or other symptoms like fever or fatigue, it's essential to consult with a healthcare professional as soon as possible. These changes in urine should never be ignored, as they can serve as a critical warning signal that your kidneys need immediate attention and care. Early intervention can help address the underlying issue and prevent further damage to the kidneys. If you notice any persistent changes, don't hesitate to reach out to your doctor for further evaluation and treatment. Persistent back pain. Pain in the lower back, especially near the kidneys, can be a sign of kidney problems such as infection, kidney stones, or even kidney disease. The kidneys are located towards the back, just below the rib cage, and when they are not functioning properly, it can lead to discomfort in this area. If you experience sharp, intense pain, especially on one side of your back, it could indicate kidney stones, which are small hard deposits that form in the kidneys. These stones can vary in size and may cause severe cramping pain when they move through the urinary tract, often felt in the lower back or side. The pain can be so intense that it may require immediate medical attention, especially if it's accompanied by other symptoms such as nausea, vomiting, or difficulty urinating. On the other hand, a dull, persistent ache or tenderness in the lower back may signal a kidney infection, also known as pyelonephritis. A kidney infection occurs when bacteria enter the kidneys, often from a urinary tract infection, UTI, that has spread. Along with back pain, a kidney infection may cause symptoms like fever, chills, fatigue, and a burning or painful sensation during urination. In more severe cases, the infection can lead to sepsis, a life-threatening condition, so it's crucial not to ignore these symptoms. In some cases, persistent lower back pain can also be a sign of chronic kidney disease, CKD, which develops gradually and may not present noticeable symptoms until it has progressed. If kidney disease is left untreated, it can lead to kidney failure, where the kidneys can no longer function properly. If you experience ongoing, unexplained back pain that doesn't improve with rest or over-the-counter pain relief, and especially if it's accompanied by other signs of kidney issues, such as changes in urination, swelling, or fatigue, it's essential to consult a healthcare provider. Ignoring persistent back pain could lead to further complications, so it's important to address the issue early to avoid more serious health concerns. Nausea and vomiting. When your kidneys aren't filtering waste properly, it can lead to a buildup of toxins and waste products in your bloodstream, a condition known as uremia. The kidneys are responsible for eliminating waste from the body through urine, and when they fail to perform this function, harmful substances accumulate in the blood. This accumulation can lead to nausea and vomiting as your body tries to rid itself of these toxins. The discomfort from nausea is often a sign that kidney function is declining, and as the problem worsens, these symptoms can become more frequent and intense. In addition to nausea and vomiting, you may also experience a general feeling of being unwell or fatigued, loss of appetite, and even a metallic taste in your mouth. The buildup of waste in the body can affect many systems, including the digestive system, making it more difficult for your body to process food and absorb essential nutrients. This can lead to weight loss and malnutrition, further weakening your overall health. The toxins that accumulate in the bloodstream can also affect your electrolytes, contributing to imbalances that may result in dizziness, confusion, or muscle cramps. If you notice these symptoms alongside nausea and vomiting, it could be an indication that your kidneys are struggling to filter out waste, and that more serious kidney issues are at play. It's essential to seek medical attention if you experience persistent nausea and vomiting, especially if it's accompanied by other signs of kidney dysfunction. These symptoms should not be ignored, as they can signal the need for immediate medical care to prevent further damage and complications. High blood pressure. The kidneys play a crucial role in regulating blood pressure by controlling the balance of fluids, electrolytes, and waste products in your body. They help maintain the delicate equilibrium necessary for proper heart and kidney function. When the kidneys aren't functioning properly, they can struggle to maintain this balance, which can lead to an increase in blood pressure. This condition is known as secondary hypertension, and it can be both a cause and a consequence of kidney problems. When blood pressure rises, it puts added pressure on the heart and the blood vessels throughout the body, including those in the kidneys. Over time, high blood pressure can lead to damage of the delicate blood vessels in the kidneys, impairing their ability to filter waste and excess fluid from the body. This damage can reduce kidney function, making it more difficult for the kidneys to maintain fluid and electrolyte balance, exacerbating the problem. This creates a harmful cycle where kidney damage leads to higher blood pressure, and elevated blood pressure in turn accelerates kidney damage. If left unchecked, this cycle can ultimately result in kidney failure, which may require dialysis or even a kidney transplant. It's important to note that high blood pressure may not present noticeable symptoms, which is why it's often referred to as the silent killer. If your blood pressure is consistently high and uncontrolled, it's crucial to seek medical attention. Uncontrolled high blood pressure significantly increases the risk of heart disease, stroke, kidney damage, and other serious health complications. Regular monitoring of blood pressure, especially as you age, is vital to ensure that both your heart and kidneys remain healthy. Managing your blood pressure through lifestyle changes, medication, and regular checkups can help prevent kidney damage and maintain overall health. If you're experiencing any of these symptoms, it's important to consult with your healthcare provider as soon as possible. Don't wait for the symptoms to worsen, as early detection can help prevent further complications and preserve kidney function. The sooner you address kidney-related concerns, the better the chances of managing or even reversing the damage. Your healthcare provider can perform tests to assess your kidney function and offer guidance on how to protect your kidneys. Ignoring symptoms can lead to more severe issues, including kidney disease, which can impact other organs and systems in your body. Remember, taking care of your kidneys means taking care of your overall health. By staying hydrated, maintaining a balanced diet, and staying active, you are supporting your kidneys in performing their vital functions. Avoid excessive salt intake, limit alcohol, and refrain from smoking, as these can negatively affect kidney health. Your kidneys play an essential role in detoxifying your body, and by prioritizing their health, you're ensuring that they can continue to do their job effectively. With a little care and attention, your kidneys will thank you, helping you lead a healthier and more vibrant life.